welcome back to Newfoundland and Labrador Studies 2205. This is Unit 3, The Country Grows, Section 3, Lesson 3, Video 3, on Changes in Healthcare. In northern Newfoundland and southern Labrador, British physician Wilfrid Grenfell and the International Grenfell Association opened several hospitals and nursing stations. They also operated medical ships that served the coast to isolated communities. This photo here is of the hospital in Battle Harbour, which was the first hospital that Wilfrid Grenfell had built. In St. John's, the Catholic Church opened St. Clare's Mercy Hospital in 1922. This first hospital is next to the current St. Clair site. Several hospitals were opened in communities thanks to private funding as well. For example, the Newfoundland Pulp and Paper Company opened the Corner Brook General Hospital in 1925 to help support the people there. Despite improvements, many communities still found themselves without professional medical care. In 1901, there were 117 doctors for a population of around 240,000 people. By 1933, there were only 83 doctors here, outside of the Grenfell Mission, and 33 of those were in St. John's, so it was very unbalanced. A response to this was outport nursing. Other communities on the island received some nursing stations thanks to the work of the Outport Nursing Committee, which was formed in 1920. This organization was later known as the Outport Nursing and Industrial Association, or NONIA, which brought nurses from England to station them in rural communities. To raise funding for these nurses and the stations, Outport women produced handicrafts sold through NONIA, and the NONIA store that is downtown in St. John's is actually the oldest store in that business community because it's still in operation today. In 1934, the Commission of Government assumed responsibility for all nursing services. I also wanted to briefly mention maternity care. The Salvation Army opened the Grace Maternity Hospital in 1923, which is depicted here. The lack of medical care and poor living conditions created a high infant mortality rate in the colony, especially when compared to the Dominion of Canada. In 1938, for every 1,000 births, there were 92 deaths, while the Dominion of Canada saw 63 deaths per 1,000 births. We had a long way to go for maternity care in Newfoundland and Labrador. Finally, let's talk about endemics and public health. Tuberculosis was an endemic in Newfoundland and Labrador during this period, infecting thousands yearly. Endemic means a virus continues to infect people in a community, not necessarily at a rapid rate. In 1908, a committee was formed to discuss strategies to combat the illness. They created the Association for the Prevention of Consumption, which is another word for tuberculosis. They focused on public awareness to prevent the disease, such as better hygiene and home sanitation. The Newfoundland government joined the fight against tuberculosis as well. In 1912, an act respecting the treatment and prevention of tuberculosis was passed, creating a state-run tuberculosis public service. The tuberculosis dispensary in St. John's opened in 1913 to diagnose and advise patients about treating and preventing the disease. Both images on this slide are showing treatments of people with tuberculosis. Because of fluid buildup on their lungs and difficulty breathing, they were often treated by having outdoor treatment and getting fresh air. An outbreak of diphtheria resulted in over 700 deaths in St. John's from 1888 to 1892. There were also concerns about cholera and smallpox. With all of these concerns, the position of public health officer was created in St. John's and expanded to include epidemic control responsibilities in 1905. In 1918, the Spanish flu arrived in the country and killed more than 600 people in Newfoundland and Labrador in just 5 months, dramatically affecting the population in Labrador. We will talk about the Spanish flu in more detail in the next section. A Royal Commission of Inquiry into Public Health was established in 1929. Their report led to the passing of the Health and Public Welfare Act of 1931, which created the Board of Health. The Board of Health at the time was responsible for controlling infectious diseases and treating the sick and improving sanitary conditions. Unfortunately, the Commission of Government did not allow the board to undertake widespread healthcare reform. But now it's time to review. I'm going to ask you to complete the activities I have for you in Brightspace, and I hope you have a great day.